Welcome to a Management Plus EHR Efficiency webinar. My name is Kevin Sloan. I'm a certified electronic health record specialist and a certified ophthalmic technician. Management Plus is an industry leader in electronic health records, and we want to provide you with the tools to make documentation within your EHR fast and accurate, as well as the skills to use these tools proficiently. Today's webinar is titled Macros Made Easy. The highlights are number one, defining the available types of macros within EHR, which are events, keywords, macros, and script buttons. Number two, why would you want to use a macro? Number three, setting up these macros. And number four, using macros like a pro. Let's get started. You'll see that I have a blank patient open within Management Plus. There are no past electronic health records, and that is for a specific reason, which I'll tell you about in just a little bit. Let's create a brand new record, and I'm going to choose the exam ophthalmology template. One of these macro types are specific to the template arrangement that you do choose, so we're going to focus on that. So let's create a brand new record. There is no past data within this record at all, and that is exactly what you want to have. Let's take a look at the special testing form. I've chosen this just as a focal point so we can focus on our macros here, so we can detail all the types on this. The first type of macro is an event. An event is something that happens when you do something else. Generally, that is set up by way of code within the background of this. Your electronic health record specialist can do that for you. An example of that is whenever you choose some items in this, there's an event that happens. Now, some may not consider this a macro, but it is more of a descriptive and display of something happening when you do something else. So if you had chosen something in this, a specific, an option in this list, and you wanted something else to happen, it could be on another form, it could be on this form. You could set up some code that would fire and do something else within your record as far as documentation. So if you had just chosen in here, evaluate response to medication, and that was it, you could actually have something else done within your health record. So that's an example of one type of macro. Keywords, that is essentially if you want to document something specific within a memo field, and it only works within a memo field. This is a particular, this control is a memo field. To activate keywords, it's Control A. It will open up a lookup list, and then you have a list of your keyword macros in this. So if you chose mild AMD, you would get this output from this, and there is some more in there. This is actually set up for the discussion and plan section, so you probably would not want to use it here, but in the physician desktop where you're documenting a plan, that's a great place to use that. But I wanted to demonstrate that you could use it across the board so that you can see that it does work in any memo field at all. So let's go back to the special tests. And then there's also the macro, for lack of better terminology. It's right up here. You can see that I have two of those made already. If it's just mild progression, you can click that and you can see everything that I have set up in this macro previously will be documented. Okay. You can do no defects as well. I'm going to show you in a minute just how to set those up. Also, another type of macro is script buttons. This is something that your EHR specialist can set up for you, but it's essentially a button that when you click the button, it's going to output the specific data each and every time. This set here is for the right eye, this is for the left, and it's going to give you the exact same output every time you click it. These are great if you have a hard and fast output that you would like to have each and every time. They're not hard to modify. Your EHR specialist can modify these actually rather quickly. So if you do change your mind and want the output to be a little different, it's not a huge ordeal to modify these macros. But it is something that we have to do for you. Number 2 on our highlights is, why would you want to use a macro? It's all about speed and efficiency within EHR to do things that are fast and efficient. That's the only way you can really sort of run with EHR, is to be fast and efficient. Anybody can document, but to really be able to have an office that runs smoothly, you have to be very fast and very efficient. And macros really help a lot when it comes to that. So during the course of a day, when you're seeing lots of patients, when you can eliminate mouse clicks, anytime you can do that, or eliminate having to navigate to another form, that is another plus. As long as you fully understand what exactly is going to happen when you utilize these macros. So it's all about speed and efficiency. So you can see those patients in a timely fashion and then focus more on your patient rather than on your documentation. Highlight number 3 is setting up these macros. The first one is the events. As I had mentioned earlier, setting up an event where something happens when you document something specific, or you trigger a checkbox or something else. It's something that we would set up for you as an EHR specialist. So if this unexplained vision loss was checked, you could actually have it document something somewhere else in the record. You could have it set a record status. There's an unlimited amount of things you could have it do. And not only just one item, you could have it do multiple items all at the same time. So if you had documented that you wanted to do cataract surgery, you certainly could fill in 5, 10, 15 other different controls with data based on that one event. So we would take care of that for you. When it comes to a keyword macro, that's something that you can do yourself. You can do it right from inside of EHR or from the front side. I'll show you both ways. So it's Control A, click your flashlight. We have keyword options right here. If you want to click Add, and then put a note in here with tape. Okay, so now we have a keyword macro. I can click that right there and actually fire it off right there on the spot. So that's a great way to document that if you're doing a lot of left fields, things for ptosis, and you don't want to have to type that in there every single time. Also from the main screen, you can do File, General Setup, Keywords, and you can see the one right here that I just created with tape. If I wanted to modify that, you would click Edit. You could modify the actual keyword itself and the text itself. You go into Others and edit those. You can delete those, and you can add them right on the spot. So just type your keyword in, type your text, and some places like in the assessment and plan section where you're going to have other options in there as well. You may want to put a space before it, and then your text, and then a space after, and it will respect that when it's fired. So it gives you a nice space in between those. So it's a great way for you to modify your keyword macros on the fly. It can be done daily. It's great to categorize those. So if you had a section for glaucoma, you could start them out with GLC and then a hyphen, and then also create categories on there. They could also be set up per physician. So you could put their initials, and you'd be able to set up groups or categories of keyword macros. And it works very, very nice. The other one for macros, I'm going to actually get out of this record and create a new one. because you want to have, again, a patient with no past records and with no data in there. This is using this particular option here. We're going to go back to the special testing. And essentially what it is you can document all of the data that you want, and then when you're done, just to file and save macro. Okay, you want to put in a visit description on there first. So let's just do one for an OCT. And we're just going to choose both eyes, the diagnosis. Let's just type in there glaucoma. You do a lot of those for glaucoma. Evaluate response to meds, the interpretation, and let's just say it was essentially normal, a normal OCT. And your plan was to observe. You could actually do this for both eyes. And let's put this on here. Glaucoma, normal OCT. So we're also going to just do optic nerve on that. So we have all of the items that we want filled out. When we utilize this macro, you could fill out some items on some other forms at the same time, and it would also document that. So if you wanted to go onto the physician desktop and put in your order for an OCT, so we would do testing orders on there, and you could do OCT, both eyes, and today as well. And once you have all of that data, it doesn't matter where you're at, you can be back on this form as well. Just do file and then save macro. So now it's saved. And you can go here and see now that we actually have a normal OCT option on there. You could rename this if you wanted that to be OCT glaucoma normal and start a category like that. Would not be a problem. I can show you how to do that. So it's file, EHR, EHR setup, and then macro. And let's just edit this. So let's just do OCT GLC normal. Okay, now we've modified that. We'll go back to there, create a brand new record. And it doesn't matter where you're at on this particular record. You can run this from right here. So if your doctor is reviewing the OCT, you can actually come up in here and say, okay, I need to document that I ordered it, and it is normal, and boom, it's just that fast you can have it. So you can see here that OCT is done there as far as the order. One thing I do want to show you that you need to be careful about is when you look at your narrative, you can see that only this is on that. You may ask, where is the data that we've documented via the macro? Well, it's actually there, but your narrative is not going to reflect it unless you actually navigate to that form. So let me demonstrate that. So we're just going to click on special testing, and then we'll go right back to the narrative, and now you can see that the data that I had set up in the macro is now there. So be careful about that. You may run your macro from another form, but sometime during the exam you want to at least navigate to that form so the HTML gets set. Otherwise, your data will be there, but it won't be in the HTML, and you could have some issues with that later. You can always modify and create other macros. So let's just go out of this record, create a new one. We haven't saved anything yet. And let's just say we wanted to modify one of the visual field macros. So I'm going to use this one here, POAG mild progression. Okay, and then I'm going to put on here POAG moderate progression. So, and then all I'm going to do for this is I'm going to modify a couple of things. Where it says generalized constriction, I'll put moderate constriction. We'll leave everything the same on there. Add medication. Let's see if let's change it to that. You know, it's a little more extensive, so we're gonna do a little bit more. So then we'll do file, save macro, and now we'll have moderate progression. And you can see that these are alphabetized or alpha sorted. And we'll go back out, create a brand new record. And again, we can use it right from here. Here's our brand new macro. But just make sure again that you do visit the form, even if it's just for a second. And you can see that this is the data that is now there, the new macro. So if you decide to delete one, the front side of that, you can delete that there. And if you want to modify it and then delete the old one, that's okay. And then give it a similar name, that's fine as well, just as long as it's organized for your doctors and your scribes and techs so that you know what's going to happen and it's clearly labeled. The last one I want to talk about is the script buttons, and that's these here. Several of these sections have script buttons, and these are macros. So if you click this, it's going to give you that output, and it'll give you this output for here. These are set up by your EHR specialist. They're not that hard to set up. Probably each one of these buttons you could set up in about 2 minutes time or less. Unless it's like a brand new one and you wanted, you know, quite a bit of data, you know, to populate when that was chosen. But something like this, it just does 1, 2, 3, 4 different items within that macro. So they're not that hard to set up. So that would be something your EHR specialist would do for you. Number 4 on our highlights is using macros like a pro. I've kind of already demonstrated that. We'll kind of go through that again quickly. So for an example, if you have your record open and you know that you're going to utilize some of these, you could come in here to the special testing section, and for your OCT, if it's for dry ARMD, you could click that. Epiretinal membrane, click that macro, and it's going to be a macular cube for this one, and then both eyes. Or you could always use this OCT here. Now I'm going to show you something here as well. If I click that, you'll notice nothing really happens, because if there's data already in that control, it will not overwrite it. So let's clear this out and then do this, and you see now the macro actually functions. If I were to clear this out, and well, let's just clear them all out, but just put one option in there. Well, let's put vitreomacular traction in there, and then do this. You'll notice that it does not change that, so it does not overwrite. So it works very nice to be able to do that. So if you wanted to default, you can click that again, and now you have it. So over here, again, you can use the script buttons as macros, or you can use the keywords in this. Control A, and it can scroll down. If you don't remember what it's called, you just scroll down through your list and hit tape, and now you have it. And then say it's malprogression, and you can see that we have exactly what we want. So it allows you to be quick and efficient. You can do it from these other forms as well. So if you wanted to use a keyword macro here or one of these other macros from right here, you certainly can. Again, make sure you navigate to that form so that it sets the HTML. With this information, you should be able to help improve the workflow within your office, make your patient flow much smoother. reduce stress on your physicians and your scribes by implementing these tools at the right time and in the right place. It's essentially a strategic setup to make you run smooth and efficient within the exam room. So you eliminate keystrokes, you eliminate navigation, and in the end, your patients are much happier, and you are much happier because you end up with more time on your hands to be able to focus on the patient. This concludes this webinar on macros made easy. I appreciate your time. Management Plus is dedicated to our clients to help them become efficient and accurate with their EHR documentation. Look forward to putting on another webinar in the near future. Stay tuned. Thank you.